Evan Jack. I think he's been in all of our schools. Some of you go to him at PT Kinetic, which he owns. Today he has also Chris with him, and Chris is now venturing and joining Evan. But what I love about Evan and his program is he does so many things. Like Dr. Evan Chaff can do Chinese medicine and all kinds of neuro therapy with patients. And anybody that I know who's gone to him, Dr. Lerner, Ms. Pancucci, let's see, Mr. Wertheim, Bridget, have come out feeling so much better both mentally and physically. Because it's not just about your physical well-being, it's about your mental as well. And so just being around him and learning so much from him is been a sheer pleasure. So we're happy to have him here today. Please give them some things that can help them. Their jobs are extremely stressful at times, fun, but stressful, and I need them to keep moving forward and feeling good about who they are and what they do, and not let the stress get in their way. So I'm turning it over to you guys now.
Oh, that was so awesome. All right, let's have some fun. I want Chris to be introduced first. I'm going to go into what I do and hopefully provide a lot of value for everybody in this room, right? Because who in this room has some stress, right? Who in this room is not a dung beetle? Everybody's hands stay down. All right, because we're humans, we have this innate ability to adapt to a stress response. And it's our ability to adapt really well or like dog poop, all right? So I'm hoping today I'm gonna create constructs for you guys to understand and explain. Because once you understand the human physiology and how the brain and nervous system work, then it's really quite simple to rehab yourself. Because my goal is to have you guys heal yourself. I want everybody in this room to be healers of yourself and your friends and family. And sometimes that's like, let me put my hand up to find a medical professional to guide me, but ultimately to know what a stress state is and what an anti-stress state is. That's gonna be my ultimate goal. And then I wanna also do some demonstrations. I think I have one guinea pig that's coming up, where we're gonna use some revolutionary technology called shockwave therapy. Who in this room has heard of shockwave therapy? Okay, and what do you guys know about shockwave? I know you know a lot about shockwave. What do you guys know about shockwave? All I hear is mumbles.
What do you know about shockwave?
Yeah, so it's high frequency ultrasound that breaks up scar tissue. And after treating 700,000 patients, 4 different degrees, I've never found technology that works better than this. And that's what I said about Chinese medicine early on. I was a PT first and became a Chinese medical doctor. And this transcended getting people out of pain faster than anything I've ever came across. Okay, so I want to use a demonstration. And the good news is we know a way to get this free for you guys at the practice. Normally, there's some doctors charging $600 a visit. The average locally in Bergen County is $295 for one session. And we could get this covered through your New Jersey plan as teachers through our practice. Okay, it's a gift we give teachers. Okay, and before we go into like the stuff, I want Chris to introduce himself. Chris has been recently added to our team. We're adding medical out of our practice. So the same excellence that we brought with rehab, we felt there was a big gap between getting patients in, because who's ever been to a doctor that had to wait 3 months for, right? It is, and for me as a clinician, when I'm seeing a patient, and about 70% of my patients come to me without a doctor's order. So I don't really, thank God I've been very blessed to build a business where I don't need doctor referrals. I love them, don't get me wrong. But if somebody needs an MRI or an image, or they need to have an ultrasound done on their legs to rule out venous insufficiency that's causing a lot of the chronic pain, my biggest issue was I couldn't get patients in to see a doctor for 2 to 3 months. And that's a big issue I have, because my patients are suffering. And if they're suffering, I can't get the results I want to have. And if they're suffering, it's affecting them and their family. And so to end suffering, we decided to bring Chris onto the practice to really revolutionize how healthcare is being performed in Bergen County. So Chris, I'm going to pass it on to you, and you just debrief who you are and such.
Thank you very much.
And I'm going to take a coffee break.
All right. Thank you very much for allowing me to be here today. Thank you very much for inviting me. So I got together with Evan about
It's a mic because of it.
Oh.
Yeah, it's a little mic. There you go.
I got together with Evan in April because I heard that he was looking to help bring in multidisciplinary into his practice. I've been doing this for about 30 years, 20 years with multidisciplinary. And it is definitely a little bit of a niche to get medical doctors on the same level as physical therapists or acupuncturists, because they're the ones that are treating the patient on a daily. They see what they're going through, whether it's the mental stress or the physical stress, and it's very hard for them to actually understand it. So what I've been working with whether it's orthopedic surgeons all the way down to physical medicine doctors, get them to understand what they're going through with you. So he brought me on, and I'm going to help him build out an amazing team of multidisciplinary physicians. That's going to be from orthopedic surgery down to sports medicine, down to chiropractic as well.
Our kids.
I love that.
And we would love to help the kids come in and learn as well.
Interns.
1,000,000%. But they have to have A's. We don't accept B's, right?
Oh, no, B's are good.
B's are good too.
Come on.
Okay. So I got together with him, and we're going to collaborate both with the Kinetic Rehab and Spine. There's a medical department that's going to be called Kinetic Medical Solutions. So over the next course of the next few months, we're already starting to implement, which he had briefly mentioned on vascular management, because what I've seen in the past years is that school teachers standing up a lot, sitting a lot, standing a lot, they actually get weighted legs, heavy legs, stressful legs, and it may not be back problems or any other different problems. It could be vascular. So we do small vascular studies. It takes 5 minutes, and we can actually see if that's the main problem. But let's just head it back here real quick, is that I'm going to be helping him bring in a team of doctors that actually meet his expectations, and hopefully they can actually exceed expectations, because it's very difficult to have all these different specialties under one roof, so you're not going from place to place to place to place, that they'll come to his office under his leadership, under his guidance and his team to actually implement what he needs and he thinks in collaboration with them for your best outcome. So that's what I'm going to help him do and implement and execute and make your lives a whole lot easier and get to do what you have to do outside of teaching, but all your other activities as well, and have a great life.
Thank you, Chris.
You got it.
And I think the microphone works best when you're holding it near your yeah.
I'm sorry, I'm Italian, so
I know. Well,
next time I'll put it on my
next time put it on the. All right, thank you, buddy. All right,
Is this on yet?
that's on. Yeah, we're live. Yeah. All right, guys. So we're here to talk about what? What do you guys want to learn about? Who's come with me? All right. Who in this room is stressed? All right, perfect. All right. So there was a physician back in the 1950s and 60s. His name was Dr. Hans Selye. And what he found was that the number one cause of all disease was stress. And now, when we think about stress, what's the number one thing you think about initially? What do you guys think? Emotional stress, maybe, right? Emotional stress.
Physical stress.
Yeah. So,
No sleep.
yeah, lack of sleep. Now, feel free on the back of these papers. I was going to wait to the end to pass these out, but I want this to be interactive. Feel free to turn the page over and write. Yes, use your hands instead of your fingers. All right. I want this to be very tactile, because if we listen and we type, or we listen and we write, we remember 10 times more for writing. Okay. All right. So stress. That's the topic today. Now, if you think about in the wild, if a deer gets chased down by a mountain lion and the mountain lion survives, do you think the mountain lion is thinking about that lion again in about 20 minutes or 30 minutes? Not really. They don't have a frontal lobe. So we have this big frontal lobe, right? And who could think about somebody or something that happened to you 20 years ago and you get a specific response? Raise your hand. Can you think about, I know you're smiling. Something that happened to you in the past, right? Think about that now. What's one thing? Don't say it aloud. Just one thing. If you think about that person, that bully, that person that got you in high school, right? When you think about that one person, do you guys feel a specific response? Right? And what happens to your heart rate? What happens to your blood pressure? Goes up, right? So we're the only animal, yes, we're an animal. We're the only animal in the animal kingdom that could think about something that's never happened in the future, or something that happened to us 20 or 30 years ago, and have that same effect. Isn't that crazy? No other animal in the animal kingdom does that. So in the wild, animals, that's why a dog who has a pet, they love you every single time you see them, right? They love on you. But you could yell at them, scream at them, and then they wag their tails and they jump on you again, right? Because they don't have a frontal lobe. And it's the frontal lobe that makes us different than any other creature on the planet. Does that make sense, guys? So what I want you to do is I need something to write on. Markers or where?
Right there.
Got it. Now this is going to be kind of difficult. Thank you, Handsome Pants. This is going to be very difficult because you probably won't be able to see this. That's why I want you guys to write this down. So we're going to draw a snowman. So draw a big head.
Just careful the Sharpie doesn't bleed through.
All right. So we got the big head. Did everybody write it down? I don't see people drawing the circles. Don't be like your students. There's no pens.
Use a marker.
I got markers. All right. All right, so we have the head. That's okay. That's okay. All right. Everybody has their head? Then we're going to draw a line going down like this. A line drawing down like this. This is such improvisation. I love this. And then we're going to draw a little itty bitty bitty body. All right, you guys are so good. All right, and then we're going to draw one leg, one arm, one leg. All right, you guys are doing so good so far. All right, so then up at the top, you're going to draw a line like that at the top. And you don't want it cut in half. You want it up top like that. It's okay if it's cut in half. All right, so why do you think the head is so big, so much bigger than the body? Ego. All right, ego, that's great. What else?
We overthink everything.
Yes. What else? What governs every single organ system in the body? Is it the nervous system or the lymphatic system? Nervous system. Nervous system. You guys are so good. You guys are so good. The nervous system. So, fun fact, did you know in utero, what is the first organ to develop in utero?
Brain.
The heart. In fact, the heart starts beating within 6 weeks of pregnancy. How wild is that? Before any other system's created. And we're going to circle back to the heart later, right? But the heart is the first organ to develop and the first thing that starts beating. And you only pronounce dead when the heart stops. So isn't it wild? And then in every tradition, whether it's Judeo-Christian or if it's Vedic traditions, they always talk about the heart. Right? So in Christianity, it's the Father and the Son. In order to get to the Father, you must go through the Son, the heart. In Vedic traditions, you have 7 chakras. You have 3 chakras below the heart and 3 chakras above. The heart is at the center. So it's pretty wild. So I believe that the reason why the heart starts beating first, because there's an innate consciousness that's born before we even are born. So it's pretty wild. Think about it. So if we have a big head up top, the brain and nervous system govern all organ systems inside the body. All muscles, all ligaments, all joints, everything's governed by the brain and nervous system. Let's just start with that. So if the nervous system is shut off, what happens to organs? So there's one nerve that goes from the back of the brain all the way down. It's called the vagus nerve. If this nerve is cut off, what happens? All other systems shut down. So think about it from this perspective. I'm going to simplify. This is cool. So we have the conscious brain, and then we have the subconscious. Conscious, subconscious. Conscious brain, subconscious. So what is consciousness? What is conscious?
No.
What's that?
What you know.
I'm sorry?
What you know.
Yeah, what you know. Yeah, what you know. And what's subconscious?
Stuff you're not aware.
Stuff you're not aware of. You're so good at this. All right, you guys are doing so good. You guys are doing so good. All right, so let's map this out a little bit more. So next to the C, I want you to write thoughts. Write thoughts. And then next to the SC, subconscious, we're going to write feelings. And then at the body, we're going to write actions. Thoughts, feelings, actions. All right, so now bear with me. If we think about that person from high school, what happened to our body? What did we feel? Didn't feel good, right? No. And then what happens to the body? The body responds to that thought. So the thought creates a feeling, and then the feeling creates an action inside the brain, inside the body. So the heart rate goes up, blood pressure goes up, right? All right, you guys tracking with me? Yeah. So who believes if we change our thoughts, we can change our feelings? Then. And then if we change our thoughts, we change our feelings, we change what happens where? In the body. Okay, good. This is a concept. All right, once you understand this concept, then I'll teach you tools how to change your thoughts, especially around the subconscious programs. So next to SC, I want you to write down 0 to 7. 0 to 7. 0 to 7. Right next to SC, 0 to 7. And why is that important? Because the first 7 years of our life, we're what's known as theta brainwave. And if you don't know what theta brainwave is a hypnotic state. So between the ages of 0 and 7 years old, we're consistently taking in everything in our environment. And our subconscious brain is being programmed. So our thoughts, theoretically, our thoughts are not really our thoughts. The thoughts we think now are not really our thoughts. They're programs from our family and our society between the ages of 0 and 7 years old. The cool thing is this, we can reprogram these. Okay, all right? That's why 0 to 7 years old, we need to know that number. Because our subconscious programs are what's driving our daily habits. So here's a mathematical equation. I want you to write health equals actions divided by identity. Health equals actions divided by identity. Health equals actions divided by identity. All right? What is identity? Yeah, our beliefs. Yeah, so an identity is a belief plus a belief plus a belief. That equals our identity. So I've done a lot of weight loss programs over the past 25 years for people. And I never could really understand why some people lost weight very quickly and other people did not lose any weight. Who's ever had that journey where your friend went on the same diet plan as you and they lost all that weight and you're like, what the, right? It happens, right? And a lot of it comes down to our subconscious beliefs that we can lose the weight. All right, so that's when we're going to dive in. The rest of this talk, we're going to talk about the thoughts and the feelings, and then how do we change the responses on the body. Is that cool? Mm-hmm. Who's coming with me? Everyone's good? Everyone's good. All right, so let's first define the 3 primary causes of stressors. Number 1, you said it before, emotional stress. So up at the top next to conscious, write down emotions. Emotions. So that's emotional stressor. Now we're going to do a technique to help reprogram any emotional traumas you might have. Now, I want you to pick a low-hanging fruit because I don't want anybody crying in this room. So I want you to think of a stressor right now. And this is called the havening technique. It was created by a Harvard researcher. And we found, it's called the psychosensory technique. What he found is if you rub your arms like this, let's have everybody do it, rub your arms like this, and you think about a traumatic event, it actually starts reprogramming a part of the brain called the amygdala. And the amygdala is where emotional trauma is stored. Okay? Doesn't it feel nice? It's like a nice little hug, right? And I think that's what he found. It's like almost like it mimics you being held as a baby. Okay? So before you rub any longer, because you're going to start feeling better, I want you to quantify that stressor that's bothering you on a 0 to 10 scale. You can write it down in a sheet of paper if you like. Just don't tell anybody. You don't have to let anybody know what it is. This is where I differ than talk therapy. I think some people respond very well to talk therapy, but we just talked about what happens when you think about a stressor. What happens to your body? Your thoughts create the feeling, and then the feeling affects the body, right? And so I'd like to just have you guys think about a stressor, quantify it on a 0 to 10 scale. You guys have everything? Raise your hand if you got a stressor. All right, perfect. All right, cool. All right, so now let's have you guys close your eyes and just follow me. And as you're closing your eyes, I want you to rub your arms side to side. You rub the top of your arms. And now as you're rubbing the arms up and down, I want you to think about that stressor. Now let that stressor go. Don't think about it. Now what I want you guys to do, and I want everyone playing full out in this, I want you to imagine yourself on the beach. And you're on the beach and you're walking and you hear the waves crashing against the sand. And I want you to count out loud to 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17. Good. Keep your eyes closed at 20. Keep your eyes closed. Keep rubbing. Now imagine a time when you were so powerful, like unstoppable. It might have been snuggling with a loved one or a dog or a pet, or it might have been when you graduated college, or it might have been when you got that raise you wanted, that promotion you wanted. I want you to feel the feeling of greatness. I want you to feel that power within yourself. I want you to put a smile on your face. I want you to feel that feeling. Feel that feeling. Now imagine where this feeling is inside the body. And I want you to put a color, a light to that feeling. Nice. Make that feeling even brighter and bigger right now. Make that color even brighter and bigger right now. Now I want you to move this color from the back of the head all the way to the top of the head, to your face, to your shoulders. I want you surrounding every cell in your body with this color, with this feeling, down your shoulders and your arms, and your chest, your mid-back, your low back, your hips, your knees and your feet. Now I want you to imagine walking on a meadow or going hiking, and we're going to count to 20 again, out loud. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Now slowly come back into the room. Now when you think about that stressor, how do you feel differently now? Who in this room was an 8 or more? Or 7 or more? And then how many in this room would drop below a 2 or 3? So this is a simple technique, and you guys have a copy of this as well. This is on my YouTube channel too. I do a lot of these trainings on my YouTube channel, so feel free. And this is a simple, easy technique to reset the emotional trauma inside the brain and nervous system. Do you guys feel differently now? Yeah. And we could also do this with affirmations. All right, so we could actually do this, and if there's something we want to create, like I'm strong, I'm powerful, I'm strong, I'm powerful, I'm strong. Whatever you want to create, you actually could start doing this and repeat affirmations at the same time. Okay? This will help reset the thermostat inside the brain. Does that make sense? All right. All right. Any questions regarding that? I have a little survey I want you guys to fill out before we go into the next lesson. Is that okay? Chris, can you pass this out for me? I feel better.
How long does it last? This calming effect about this traumatic
Some people, that was a great question. You guys hear that question? How long does it last? That's a great question. Now, it depends on the trauma, right? A childhood trauma, it could last a day, and then you got to repeat it the next day. It's like bathing on Monday and expect to be clean on a Friday, right? Repetition is the mother of skill. So when I first learned these techniques, I was doing it almost every 15, 20 minutes to try to reprogram some of the emotional trauma I had as a kid. And then as you get more skillful at it and you get rid of the big traumas, the little traumas are easy to get rid of. Yeah. So I would suggest picking like a weekend where you can work through some deep stuff and you're working on it. And then if it doesn't drop below a 2, do it again. And just repeat it until it drops below a 2.
I get a lot of questions all the time, but what if you blocked out your trauma?
A lot of people do. Yeah. Yeah, a lot of people. So then pick another trauma. And maybe trauma is not the right word. It might be stressor. And you start small. Because what I found when I started doing this is I blocked out a lot of my trauma as a kid, but then memories started coming back. Because I pushed it so deep, and then they started coming back and I worked through them. Yeah. So you start superficial and work really deep. I take a couple minutes to fill this out. Here, Chris. We could, at the end, yeah. I'm going to be a good teacher and walk around and stare at you guys awkwardly. Who needs a pen?
Jamie does. I have like 10 minutes.
Jamie.
He's very impressive.
I am. This is ominous as I'm walking. You spelled your name wrong. When you're done, just flip your paper over so I know that Chris and I would know that you guys are done. I should have given you guys a time. Chris, can you set your timer on your phone for 3 minutes? You don't have to sign the backside unless you're getting work done today.
Only Jeremy.
Yeah, Jeremy, you can sign the backside so I can work on you. All right.
That was the first thing you did.
Yeah. You're the one that's always thorough, aren't you? That's why you're leader on the team, right? Details. I love seeing the detail-specific people.
She was bothered by it too.
Our next presenter in the parking lot.
All right. Yeah. Chris, how much time is left? All right, 1 minute, everybody. Raise your hand if you're done. Raise your hand if you're done. Everybody done? All right, let's get started. All right. So how many of you guys have circled You don't have to raise your hand so you're not embarrassed, but feel free to raise your hand. Okay, I don't want to call anybody. How many people circled 10 or more items? Why don't you guys count the items so that you know? 10 or more? Okay, good. Brave, I love it. 9. 8. Let's go 6. 4. 4 or more? Okay. Who had under 4? That's great. Who had under 3? Same people. 2? Good. Yeah. So if you guys raised your hand and you had 4 or more, let's talk. All right. There's ways for us to get you guys feeling better. All right. And the rest of the presentation, we're going to go into part of 2 through 8. And also the whole entire sheet. The next 25 minutes, we're going to go into all this. Okay. So let's break out your snowman. And we have the conscious side is emotions, right? So then emotional stressors. So there's 2 other stressors I want to discuss today. One stressor is physical stressors. All right. So let's go around the room. What are some physical stressors you guys could think of? Physical stressors, like pain. Okay, all right. So that'd be one. I gave you an easy one. The other one's gonna be pretty difficult. What are some other stressors? Physical stressors we could think of.
I don't know what you mean by physical stress.
Anything that physically is in the body. So we have the emotional, which is our thoughts, and then anything physically inside the body.
But I was thinking like, while I'm carrying my laptop on my shoulder.
Oh, got it. Got it. More on the side of pain, illness. Sleep could fit into that if it's driven by pain or hormones. Yep.
Fatigue kind of like both.
Yeah, fatigue within it. You guys are asking great questions. So I'm going to be much more specific then. All right, thank you. All right, so anything with physical side of things, we're thinking musculoskeletal, which is joint, ligament, tendons, disc. Okay, does that make sense? Neurological, which could be fatigue. It could be energy. That could also be hormonal. Neuropathy. Anybody in this room have neuropathy? Pins and needles into the feet and hands. That's great. It's often very difficult to treat. We do really well with it in our practice using shockwave. And the third is the vascular system, which I think Chris brought this up. Now, I'm going to give a little story, and you guys might relate to this. So 2 or 3 years ago, we started having a flood in my backyard. And we, who's ever had a flood in the backyard that went into the basement? And that was happening to us. And every time it rained in Mawa, that's where I live, we would have water come into the basement. So we decided to put a drain. And we put the drain in the backyard. And next time it rained, it worked great. The water in the backyard went through the drain, went out to the sewer. A year later, the drain stopped working. And so the water started pulling up again. And the water started backfilling into my basement. Then it's a torrential down. Who remembers that downpour like 2 years ago, where it was like massive amounts of rain in a very short amount of time? The rain came up to my knee. That's how bad it was in my backyard. And my wife and I were panicking because we had to replace the floors in our basement. And so we go in the backyard. I'm standing in this right next to the drain, and I go inside the drain. And I pull leaves out. Right when I pull the leaves out, guess what happened to the water? So think about this. Think about our circulatory system. The heart beats, it moves blood to our extremities. And what should happen is that blood should move from the extremities back up towards the heart. That's how it works. Okay? Now, if we have a drain not working well inside the body, it's called a valve. And these valves are in every single vein inside the body. But specifically, they affect the lower body a lot more. This is how spider veins happen. There's a valve that's dysfunctional, very similar to that drain in my house. And if these valves over time become more and more dysfunctional, the legs start swelling, the feet start going numb. And if you fast forward 20 or 30 years down the road, you start getting what's known as venous ulcers. And these could cause death. So they don't cause anything early on. You don't feel anything really early on. But it's one simple thing that if we get checked to see if we have a vein that's dysfunctional, we don't have to do anything about it. But as long as we get it checked, we know how the valves are working. It's really important. It is estimated that, who in this room is 35 years old or older? Who's younger than 35? This single person. So you have nothing to worry about, I think. Between the ages of 35 and 40 years old, it is estimated diagnosed venous insufficiency is what I'm talking about. Diagnosed venous insufficiency, 25% of Americans have it at 35 years old. And then when we hit 40, it almost doubles. And this is diagnosed venous insufficiency. How many of us ever got our veins checked in this room? So think about that. Nobody. So this is 50% of the population over the age of 40 have venous insufficiency, but how many of us have had it checked? Right? So what I would suggest, if you guys speak to Chris after this, if you ever want to get your veins checked, we do venous mapping. Let's see how the valves are working, because it might not affect you now, but long term it can have deleterious effects on your health. And it's a major stressor, because think about it. The heart has to work much harder. What's the number one cause of death in America? Heart disease. So if the veins are not working well, if they're dysfunctional, then the heart has to work harder to pump. You see? And so it's all interconnected. So speak to Chris after this if you guys ever want to get checked and do vein mapping. Okay? All right. So we have musculoskeletal system stressors. We have neurological stressors, then we get vascular stressors. Those three stressors add up over time. When you combine that with emotional stressors, and the body starts breaking down. Does that make sense? All right. Jeremy, I think I should work on you now. All right. All right. While Jeremy's coming up, let's open the forum a little bit on any questions people might have. Thank you, Sire. Thank you, Sire. Thank you, Sire. Any questions while Jeremy's up here? I'll have Chris discuss that. Chris, how would you like to go over vein mapping? You want to use the mic? She wants to. That's a good question, because I'm sure a lot of people have questions. Speaking to the mic.
Yeah, I'm gonna put it on my like this. It actually really is simple, but it has to be done properly as well. So there are ultrasound vein technicians, but they're overlooked by vascular surgeons to make sure that it looks exactly the way it should look. They'll actually do an ultrasound of your legs. It takes probably about 45 minutes to get this done, but they'll take the vein ultrasound and then the physician will review it and map out where there's any insufficiencies or anything that the doctor needs to take care of. And then he would sit down and actually explain it to you and go over that with you and formulate a time. The best thing, if you're getting any leg swelling right now or anything like that, you can start to wear compression stockings. That can potentially help, but those things do not fix the valves in your legs. It'll just help the symptom feel better for a little bit. But like you had mentioned, what does it entail? It's a simple ultrasound, which takes about 45 minutes, and then it takes probably about 15-20 minutes for the doctor to interpret, and then they'll bring you back in and explain it to you. It's about an hour's worth of your time, but it's well worth your time.
Evan suggested having it at a certain age, not necessarily if you have swelling or not. He just said more like a preventative.
Sure, right. You know,
for most doctors, are you calling up and saying, "I'd like to do some vein mapping. I don't have any swelling"?
you know, most people don't do it until they may start feeling heavy or swelling, right? It's like us going to the dentist. We go.
Varicose veins, spider veins. Those are indications.
If you see like any small blue spider veins coming up, like those are just the early stages of it that you see that can be turned into huge varicose veins. But that deterioration of the valves has already started well before that, right? So you know, it's like people going to the dentist. They go twice a year. They look at their teeth. Oh wow, like my teeth look great. But we never go to the doctor for our internal medicine or even orthopedics. Most people wait until pain comes for it to take care of it. This is a simple tool where at a certain age, a physician can actually there's two types of ultrasounds. They can do a initial ultrasound, which takes 5 minutes, and they can just.
Can we talk about that for a second? I'm sorry to interrupt. And I don't know if this is going to be loud, Andrew, in the school systems, but when we do our teacher appreciation events, we can bring an ultrasound tech with us and screen people. And I don't know if that would be allowed, but it gives us an opportunity to, if a vein does trip, like let's do further diagnostics. I don't know if that's possible. I don't know if you guys are interested in something like that, but it's something as easy as us just bringing a vein tech with us.
Correct.
Yeah.
We do it all the time. Do it all the time because, yes.
I feel that one of the biggest barriers for my wellness is time.
Yes.
We have our teachers. There's a substitute that'll come if they need to not be there. We don't have that, so we're less likely to leave the building during the school day when the kids are in the building. Talk to us about the hours of your practice and how that, like, weekend, or what flexibility around time.
Would weekends be beneficial?
I'm just asking what exists for your practice now.
Right now, we're open 8 to 7.
Yeah, there's a lot of admin that go there, so they make it work after their regular.
Seven
Yeah.
o'clock is
And I'm sure if there's special cases,
He'll work.
Evan works 7 days a week.
It's true, dude. I may not treat 7 days a week, but I'll have a team ready for you.
Yeah.
Everybody, just ask Andrew, if you guys need, take my cell phone. I'm gonna give you my personal cell phone. If you need anything, just text me directly. It's 201-248-5854. 201-248-5854. And Chris, do you want to give yours?
Mine is 732-768-4213. 732-768-4213.
And you can text us same day. We'll be able to get you in. Because that's Bridget. We want to get you guys taken care of as quickly as possible. That's it. And my biggest thing is time too, because there's nothing more than I get pissed off when I refer a patient to a doctor and it takes 2 months to get an MRI. That's ridiculous. The patients are suffering. We have patients that come in with disc herniations, true disc herniations, with symptoms going down the leg. Their muscles are atrophying because there's no nerve energy to the area, and the doctor can't get them in for 2 months. That is a crying shame, and nobody should accept that. Sorry, that's my
Richard,
soapbox.
how did you feel after you started? Because I know Rich feels, and his wife goes,
I
Dr.
just went
Lerner.
to acupuncture the other day. I love it.
Yeah, Evan does acupuncture.
Thank you.
I did have a question.
Yes.
Wednesday. So going from teaching and standing all the time to now sitting so much, what is the happy medium? Because in our jobs, honestly,
Yep.
it's hard to either be standing all the time or walking around and sitting. There's just a lot of. So what's a good balance? A good golden standard?
Between sitting and standing?
Yeah.
Okay. Ideally, you want to move every 20 to 30 minutes. That's it. But then if you're standing all day, you want to sit every 30, 40 minutes. All right, so you want to, because if you do fall into that category of venous insufficiency, the longer you stand, the more blood pools, right? And the more you sit, the more likely you're going to have postural distortion issues that cause pain, right? So there is a happy balance there. I err on the side of I can't stand sitting. That's just the way my body moves. I don't like being behind a computer. I don't like being behind a desk. I take all my phone calls. Just ask Chris. As I'm like we had an hour meeting just walking. And that's how I do all my meetings. I cannot sit. I think part of it is my ADHD. The other part is 100%. The other part is my body just doesn't like it. I need to move. Like right when I get up in the morning at 5:30, I start my exercises. I start moving right when I get up. It wasn't always like that, but that's the habit. Remember we talked about identity and creating habits? My habit is the moment I wake up is the moment I start moving every single day. I don't hit snooze on my alarm clock. It's time for me to go. And that took me a long time to get to. Not very long, shorter than you think. But just creating discipline and habits. Multiple sclerosis? Yeah. So neurological issues, we use virtual reality in our practice to rehab the brain and nervous system. Want me to go into this a little bit?
Yeah, a little bit.
Okay. So we have, I should have brought my laser. So we have a specialized laser that's it's called transcranial laser. It's a cold laser, but it actually goes through the skull. And we could actually bring blood flow to different parts of the brain. And so what we do is we assess the body to see which brain, left or right side, is dysfunctional. And I'm going to go into this, if I have time, when I start talking about the chemical side of things. We might not have time, so I might have to come back for a second class for you guys. But sometimes people, here, I'll just show you. I'm going to use Jeremy's. Jeremy, can you stand up for me? Move your shoulder for me. And what bothers you?
I have pain in the back of my shoulder, like right here.
Does it hurt when you move it?
No, no, it just kind of aches all the time.
Push up into my hand. Any pain with that?
Nope.
Okay. Push up again. How'd that feel?
Okay.
Okay. Now push up into my hand. Good. Now turn to face this way. So I have a sinking feeling it's not his shoulder. Now bring the elbow up. How's that feel? Feels pretty okay. Now turn your head left from me and then tilt the head back.
That hurts.
That bites. Okay, cool. All right. So we have an indication test. How's it feel on this side? Tilt it back.
It's not as
Oh,
bad.
no,
It's not as bad.
I'd
It's much,
enjoy
much
it if
more
other
sensitive.
people
Okay.
saw
All right.
other people
So watch this, guys. I want you to be mindful. Feet together for me. Actually, you know what? Let's have some fun. I'm going to embarrass you a little bit. Let's have you step forward a little bit. Good. Now from here, I want you to close your eyes and I want you to march in place. But I want your knees going to your chest. So I don't want anybody saying anything. You don't have to go so high with the legs. Yeah. Good, keep on going. You're doing great. Another 30 seconds or so. Good. Now feet together. Now close your eyes. And I don't know if you notice this. You can open up your eyes. See where he moved? All right. Did you see where he went? He started here. He moved forward and to the right. Okay? So he has something going on in his brain and nervous system. So the left and right brain is not communicating as well as it should. All right? So if the left and right brain don't communicate, write this down. The right brain is parasympathetic in nature. Right brain is parasympathetic. That's like the rest, digest, recover. That's the anti-stress side. The left brain is pro-stress. It loves stress. Right? So if we have an imbalance between the left and right brain, and most people have an 80% deficiency on one side. And typically it's the right brain is deficient. Okay? Right now he's presenting just the opposite, that his left brain is deficient. But I don't believe that. Okay? All right, I don't believe that because I've seen so many cases. So let's have some fun here. Come over here, take a seat for me. All right, so what we would do in the clinic is I would put a laser on, it's called the cerebellum on this side, and then I would do laser here. But since we don't have a laser, I'm just gonna do some stimulation to the left cerebellum. Real quick. I just want to get some activation to the left side of the brain. And then I want to reassess his range of motion on the right side. I want to see how much better it is. And to answer your question regarding MS, this would be something very similar to what we do. Now, let's have you turn your head right and tilt it back.
Still hurts.
The same? Mm-hmm. Okay. So let's try this side. Because if you remember, he actually turned to the right. So let's see. All right. Let's see. Did that make a change?
A little bit.
So that actually made a change. So right now, the test was accurate. All right. So I'm just going to stimulate this a little bit more. Is this you?
It was. Does anybody know this guy?
Now I'm just going to do that. Now turn your head this way and tilt it back.
Still hurts.
The same, better or worse?
Maybe a little bit better.
Okay. All right. So for him, treating from the top down will probably not help him. So I'm going to come in a little bit lower. So I'm going to go right into the neck now. So what I'm going to feel for is scar tissue.
That's amazing.
Yeah. So commonly, so what we do in a clinic is we chunk the body into 5 different zones. The head and brain is zone 1. Zone 2 is upper neck, shoulder, elbow, wrist. Zone 3 is the diaphragm, thoracic spine. Zone 4 is pelvis. Zone 5 is foot and ankle. And when we chunk out those different zones, we don't chase pain. We fix the zone. And that's why we get results where other clinics don't. And how I know that people need specific care is because they should respond extremely fast with this kind of work. And if they're not responding very quickly, I need to refer them out. Hence why I want to have medical in the practice, because then we could do x-rays or images, MRIs very quickly. Okay, all right, so now.
It's a little bit better.
Good. So now I want to do the shockwave. Whoa!
Yes.
You've been waiting for this.
I have.
All right.
So just so everyone knows, I went to Evan's practice in Park Ridge when it was there.
Slide
and
over
had
towards me.
shockwave on my back, and it was like a miracle.
Here, sit here for me. Just come closer. Yeah, there we go. All right, so shockwave, you know it better than anybody. Shockwave is a high frequency ultrasound that breaks up scar tissue. And everybody here can get a free session of it. So you just text me when you want to come in and get it done. And it's meant to be uncomfortable, but you don't want the discomfort to be more than a 5 out of 10. So I'm going to lower this down a little bit.
I did, yeah.
How's that?
I know what the result's going to be, so I'm
Alright.
willing to deal with I know what it is, but yeah, it's incredible.
So what I like to do is I like to put the muscle on stretch as I'm doing this. So I want you to side bend your head. There it goes. And just by putting on stretch, we get a different result in the tissue. You okay?
Yeah, it's right there.
Can you bring your right arm across your body? And put it on your left lap. There you go. If you guys want, because we only got 6 minutes left, text Chris now if you want to schedule time to come in for the shockwave session. Okay? So feel free, text Chris and Chris will coordinate getting you guys in, okay? All right. So normally we go a lot longer than that, but for time purposes, because I still want to go into we got one more stressor to discuss. Thank you, Chris. Thank you, handsome.
Evan, you know, a lot of the things that the administrators, we all deal
How much
with,
better is
is
that?
a lot of, serious, we deal with some mental health stuff, with the adults, but also with the kids. Sometimes, it's hard to leave that stuff at the door.
Mm-hmm.
I know for myself, I'll speak for myself, as involved as I am with so many things, it's hard to debrief and leave it. What kinds of things or techniques would you give them for that?
Pause, take a breath. That is the best advice I could give. Pause, take a breath, and ask for guidance. You're basically talking to your subconscious brain. Okay, first you go, what the F? And then you're like, okay, because this happened yesterday in my practice. A patient pushed one of my employees. Yeah. And so my first instinct was to kick the guy in the nuts. But the second instinct was, you need to go apologize. So at first I said to myself, okay, pause, he's probably having a bad day, he's not feeling good. And then I said, I'm not going to treat you unless you go apologize sincerely to her. And he gave me lip, and I'm like, then you're not going to be seen, you'll be kicked out of the practice. Because there's 0 tolerance, right? And pause. I want to kick you in the face, and then decided not to. And then, yeah, very good idea. And then he did go apologize, right? And then his wife felt horrible, but now I'm going to turn this right now.
That still hurts there.
Yeah, we need more love on this.
Yes,
Yeah,
I know.
yeah, it's
They
probably.
gave me a prescription for PT. So
Yeah,
I
let's
would
get you in.
deal with that.
So ideally, what we should see is immediate change with this. So did you have an X-ray recently?
Yeah, I had one yesterday.
Okay, so we don't know the results yet?
I mean, they said that they believe it's a cervical spine issue.
It is. Yeah, it's not your shoulder.
Yeah.
Yeah. All right, we get a spin. Shockwave for probably a full session, you probably feel a lot better. All right.
Thank
All right, when are you coming in?
As soon as possible.
All right, just text me.
Today.
All right. All right, so we got 3 minutes left. So the last stressor I want to discuss real quick, because we discussed stressor number 1 is emotional stressor. Stressor number 2 is physical stressors. And physical stressors are musculoskeletal pain, the nervous system, and vein problems, right? Those are the primary physical stressors. The third thing is chemical stressors. Guess what that is? Deficiency and toxicity. All right? So we have, write this down, we have 2 states of being at any given time. 2 states of being. We're either in a powerful state or we're in a primitive state. 2 states of being. The powerful state is your anti-stress state. Your primitive state is the stress state. So believe it or not, there's foods that feed the stress state. And there's foods that inhibit the stress state and activate the anti-stress state. And guess what foods those are? What's that?
Sugar, coffee.
Which the what decreases stress inside the body?
The alkaline.
Avocados, they seem to like everything.
I love you doing it. All right. So what if I told you that fruits, honey, and maple syrup actually decrease stress inside the body? And what if I told you that polyunsaturated fatty acids from vegetable oils, nuts, seeds, and those oils are actually pro-inflammatory and they cause stress?
And you eat those things
Can't eat
like
almonds anymore?
nonstop.
So any kind of vegetable oil, they're called polyunsaturated fatty acids. If you Google polyunsaturated fatty acids, you get a list of the foods that are anti-metabolism, which is stress metabolism. So we talked about this real quick earlier. There's one diet plan that I've found helps everybody. And I don't care if you're a woman, I don't care if you're through menopause or you're not menopause, I don't care. Because we've seen some incredible results in a month for most of, I like to say, our women that come to see me. Anywhere between 20 and 30 pounds within a month. Yes, I said that. Without using Ozempic or Wegovy or any kind of GLP agonist. Okay? All right? It is the concept of eating only fruits to 4 o'clock.
Only fruits before 4 o'clock.
Only, any kind of fruit. So think about this. Who's ever heard of intermittent fasting? You're doing fruit fasting. That's it. You're eating fruits only. And do you know what's in my coffee? You guys are going to think, oh my gosh, this guy's crazy. I can't believe it. Raw cane sugar, 4 tablespoons of, no, I'm sorry, not tablespoons. 4 teaspoons of raw cane sugar.
Like that brown sugar.
Brown sugar, yeah. It's turbinado sugar. You can buy it at Starbucks. And so this is the challenge I have for you guys. Test it. It is. I'm at about 300 to 400 grams of carbohydrates per day from fruits, honey, maple syrup, and raw cane sugars. And that is pro-metabolic. My body temperature went from 95.0 up to 97.6. Correct. So if you guys want to really have a deep understanding on how chemical stressors are affecting you, check your body temperature the first thing in the morning when you wake up. And do oral thermometer. If your body temperature is below 97.6, you're in a stress metabolic state. So then the body's going to have a lot of difficulty healing itself. Your body's going to have a lot of difficulty losing weight. And if you want to learn more, just go to my YouTube channel. I have this all over my YouTube channel. I explain how the cell functions. There's a cycle called Randle's cycle inside the cell. The body has difficulty metabolizing fat and carbohydrates at the same time. So when you have a fat like pizza with a carbohydrate like gluten, bread, it actually stores fat. But if you have fruits by themselves, it doesn't raise insulin. It doesn't cause fat. It actually starts increasing metabolism, and you burn fat much faster. Okay? So
Does it matter what you eat at night?
it,
After 4 p.m.?
it does, but that's fine-tuning things. That's not for this. But the fruits till 4 concept, you can have fruits after 4, but only fruits till 4. So in the morning, no milk, no dairy in your coffee. Try maple syrup. It tastes so good. So 2 things I want you guys to go home with. 3 things. Number 1, the Havening technique. Who remembers this? You probably don't remember how to do it, right? But it's okay. It's on my YouTube channel. You can watch it. That's number 1. If you don't remember the whole thing, just do this and feel good. That's it. Simple, easy. Number 2, fruits till 4. If you want to decrease inflammation, that is the best way. And this is based on how the cell functions, the cell metabolism. You're either in a fight or flight response state, which is the stress state, or you're in the rest and adjust recovery state. And fruits to 4 puts you into that state. It's all about how mitochondria functions. And if you want to learn more, just go to my YouTube channel or just schedule an appointment with me. I'll be able to help you guys. Okay? Or if you want me to talk about this again, we'll just create another lecture on that. That one, last time I did that talk, that was a full hour just talking about diet. Okay? And how it works. And number 3 is get your veins checked. That's pretty much it. You don't know until you know. And it's one of those simple things, almost like just getting your skin checked, getting teeth checked. It's one of those things that should be relatively routine. Okay? What questions do we have? Because we're over time.
How often do you get that checked?
Well, the thing is, you could, if you get it checked and they find it's positive, you either have a choice to either get them fixed, which is a minor procedure, or you just monitor. And then you could do it yearly after that. Would you say yearly monitor if they don't get the procedure done?
If they don't, I mean, the physicians I've worked with in the past is 1 to 2 years. It won't be like every 6 months. It takes time to formulate. If it's not there, it's not there. There's numbers. There's a number where they say, okay, you're a candidate to take care of it, and then there's numbers where it falls below that, and that's what you kind of monitor. So if you're at 0 and you're at 0, it takes a while for it to build up. But if you're getting closer to that number where they need to take care of it, then you should get taken care of it.
Thank you. One thing, you guys probably wondering what this shirt is all about. What are peptides? Who had that question? All right. So who's ever heard of a protein? Proteins get broken into amino acids. And then amino acids are the building block of connective tissue, organs, muscle tissues, and our DNA. So in the 1960s, a Russian scientist was able to formulate the amino acid sequencing of every organ system in the body. And so each organ system has an amino acid profile. Like the thyroid has its own, the thymus gland has its own, the stomach has its own, muscles have their own. And so there's peptides that are the signaling molecules that start repairing the organs themselves. So up until recently, you needed a doctor to prescribe these, and they had to be injected. So now at our clinic, we have peptides that help with hair, skin, and nails. So they reverse the graying of hair. They reduce wrinkles in the face. They activate stem cells. We have peptides that help out with pain and inflammation. We have one peptide that improves immune function. So during cold and flu season, that's really helpful. We have peptides that regenerate muscle tissue. We have sex performance enhancing peptides as well. And if you want to talk to me privately, just text me on that one. And then we also have a peptide for weight loss and muscle growth. And so these peptides are not injectable. They're actually biostrips that go on the tongue and they dissolve. So it's pretty powerful stuff. And up until recently, you had to get them prescribed by a physician. And we have great clinical outcomes with them. And so now we're having a back to school sale. So if you guys are ever interested, just let me know.
I'm going to come around and walk around.
And if you guys have any questions for me, just text me. I know that you have to get to the next person, so I'll start breaking down. While I'm breaking down, can they come up and ask questions? So as I'm breaking down, can they come up and ask questions? Yeah. You guys, I'm breaking down things. If you need to ask me questions personally, just let me know, okay?